have Medicare Part B. Dr. Tienn Trinh from the American Medical Center is hosting events to help you navigate the benefits and options. Welcome so much. Thank you for joining us, Doctor.
And Carmen, thank you for inviting me to be here.
Perfect.
Yes.
And I know you said you are an internal medicine doctor at a American Medical Center.
Correct.
So tell us more about how that relates to Medicare.
Well, as you know, internal medicine, we specialize in taking care of adults. And in reality, we take care mostly of people after age 65. And this is what I do for the past 25 years, is taking care of Medicare patients.
Wow. And I know we're talking about a very specific part of Medicare, right, Part B. And so as we were talking earlier, I mean, a lot of people, you hear the word Medicare, but maybe don't understand that there are a lot of benefits associated with it. So maybe can you enlighten us on that topic?
So Medicare, at least for WARM, there are three components. There's Part A, which deal with the hospital, mostly, and skilled nursing facility. Part B, dealing with physicians, and Part D is deal with pharmacy. So the program we have is for people who have Part B. So in order to participate in our program, you must have Medicare Part B. Now, Medicare is an insurance company.
Right.
It's essentially, Medicare has all the benefits that all the other insurance have. So in reality, all insurance in this country mimic the Medicare program. Right. So if you have Medicare Part A or Part B, you essentially have all the benefits of all the medical care that you need to take care of you.
Wow.
And this is, I hate to say it right now, Medicare is probably the best insurance you can have if you age 65 or older, but that you have a lot of benefits that hopefully by the end of this program that you know you're going to have. The program that we have is a program that I developed for the Medicare population in California. We have about 22,000 people on the program in California. Dr. Nguyen, who is the owner of American Medical Center, heard about me, reached out to me, and asked me to bring my program here to WARM to offer this preventive healthcare program to our seniors on WARM.
Very cool. And I know you mentioned the word preventative. And so what type of issues do you deal with, and what are you trying to prevent?
Okay. So, you know, taking care of Medicare patients, I hear this all the time. People come to me and say, oh, doctor, I'm old. This is why I feel this way. This is why I have pain. This is why I cannot do this, can't do that. And I think that is a misconception about aging. To me, age does not matter. It's how you view life and how you react to life is what matters. Our program, we do not want our patients just to exist. We want our patients to live, and we want them to live with joy and to live with a purpose. And that's what we're here for. And in order to do that, they must have their health.
Right.
And so our goal for our patients is we want them to be independent and to be in control of their health and pretty much to do whatever they want to do, regardless of what age they are. So that's why we focus on disease prevention, we focus on health maintenance, and we focus on early intervention in case our patient gets sick.
Right, and those are all really important aspects of health. I mean, no one wants to go to a hospital, I think, as often, and if it can be prevented, that is such an important part. And I know you are also having sessions where people can learn more about this Medicare program. Is that correct?
Correct. Oh, you know, we are visiting different senior centers.
Nice.
So that we go out there, talk to people about our program, what we do, and then to answer not only question about our program, but also answer question about Medicare benefit in general. But really, the program, you look at it, is there's three components. Now, the traditional way of people coming to see doctors, they wait until they get really sick, and then they pick up the phone and say, "Doctor, I'm sick. Please, I want to see you."
Right.
But you think about it, that's not the right way of taking care of people. Our way is that we see our patient on a regular basis. I see my patient anywhere between 2 to 8 times a year, depending on how sick you are.
Wow.
If you're healthy, I see you twice a year. If you are sicker and you need more of my attention, I see you maybe 8 times a year or maybe more. Whatever your need is, we will take care of you that way. So we see our patient when they are well, and then we would try to keep them well. So that's a slightly different concept.
Hey.
And then in between, we know that in between the appointment, patient by themselves. So what we do is that we assign a nurse to every single patient on the program. And the job of that nurse is to reach out to our patients on a monthly basis, bi-weekly, every week, depending on their needs, to make sure that, you know, they're following the plans that they agree with me in terms of how to keep themselves healthy.
Right.
Okay? And that's our program. That's a lot. We want to maintain connection with the patient even when they are not in the office.
Very cool.
And that connectivity is the key in keeping them healthy.
Right, keeping that momentum. I like
Correct.
that. And so if someone is seeing this at home and they want to know how can they get involved with this program, they want to meet you, probably, where should they go to find out more information?
Well, American Medical Center has 2 centers, one in Manilao and one in Tamuning. If they call Manilao, that's why I station, the staff that would know, call me and said, I'm interested in joining the Medicare preventive program. They will schedule them to come and see me for an appointment, and I will sit down and explain the home program in details and what we do and how we go about doing it, keeping them in good health.
Nice. So again, don't forget to make that call if this is about you or someone you love in your family. We'll be back right after the break.